her opening remarks. Dr. Etienne, you have the floor.
Thank you, Sebastian. A very good morning to you, and let me thank you again for joining today's press briefing. This past week, the Americas reported nearly 1.6 million new cases of COVID-19, virtually half of all new global cases, indicating that we are still being heavily impacted by the pandemic. However, after many weeks of increases in COVID-19 cases and deaths, we are starting to see improving trends in some of the more heavily affected countries, including the United States and Brazil. There are also positive signs in Panama, Costa Rica, Chile, and Argentina. Now, this is cause for hope, but not yet for celebration. The number of COVID deaths continues to escalate across the Americas, a sign that many health systems remain overwhelmed, particularly in those places that carry a heavy burden of COVID-19 infections. Central America, especially parts of Honduras, El Salvador, and Guatemala, are reporting a rise in cases over the past 2 weeks, as is the Amazon region along the border between Brazil, Colombia, and Peru. The Caribbean is experiencing a significant rise in infections, particularly in the Dominican Republic, Cuba, Barbados, and St. Lucia. COVID transmission is very dynamic and affects countries and subregions differently, thanks in part to the control measures that we've put in place. But this is the nature of the pandemic. Transmission increases every time we let our guard down and disregard preventive measures that have been proven to limit the spread of this virus. A well-coordinated response that employs the full range of public health measures is still our best hope of stopping transmission in the short term. I know that there have been lots of concerns about the variants. When a virus circulates, it mutates and adapts. And this is not rare. It is an expected biological feature of viral outbreaks. The more a virus spreads, the more likely that variants will emerge. So it is not unexpected that a virus as widespread as COVID-19, which is circulating all over the world, has resulted in numerous variants appearing since the beginning of this pandemic. Most of these variants have very few implications for transmission or severity of disease. Occasionally, a few of these variants may change, and they may change how the virus behaves, and these variants must be closely monitored. We refer to these as variants of concern. And today I will address these variants of concern, sharing what we know about them and how we can monitor and address them in the Americas. Although some of the variants are commonly referred to by the place where they were first detected, like the UK, Brazil, and South Africa, their circulation is not restricted to these places. We certainly expect that the WHO will rename some of the variants to avoid stigmatizing the countries in which they were first identified. It's important to note that we have identified the three main variants of concern circulating in the Americas. At least 19 countries in our region have reported at least one variant of concern, although PAHO is analyzing and updating this data continuously. Evidence is beginning to suggest that some of these variants, such as the ones first detected in Brazil and the United Kingdom, may be more easily passed on from one person to the next, therefore accelerating a rise in COVID cases. While we don't yet have the full picture, it is starting to become clearer. Each new variant of concern must be monitored closely to detect any changes in how it behaves and spreads, and to ensure adequate measures are in place to control it. There is no reason for alarm, but for attention. And I want to emphasize three important points. It is important that our response to the pandemic be guided by evidence and not speculation. Let me say that again. Our response to the pandemic must be guided by evidence and not speculation. And that's why PAHO works closely with some of the best scientists in the world, many of whom happen to be based in our region. They are outstanding research teams working on the ground in places like Manaus, Brazil, who are focusing on this issue and providing us with information as swiftly as they can. Responding to the variants of concern requires widespread collaboration. So new information is quickly identified and responses can be adapted as required. And that's why PAHO's surveillance network is keeping a close watch on today's variants of concern and working closely with similar efforts around the globe. PAHO's regional genomic surveillance network has increased our ability to sequence virus samples by 50% since the beginning of this year. At least 11 countries in our region can sequence virus samples and detect the presence of variants. We also count on our two reference laboratories based in Chile and Brazil, which are receiving virus samples from across our region and supporting a network of national laboratories. We must stay focused in improving our capacity for surveillance so we can keep track of trends, including the variants of concern. So far, the evidence on these variants does not change the fundamental aspects of our pandemic response. Our recommendations to prevent this virus remain the same. Uphold strong surveillance, limit gatherings, and practice social distancing, frequent hand hygiene, and mask wearing. All of these are still necessary and they do work against COVID-19 in all its forms. By continuing to adopt these practices, even after we are vaccinated, we can not only limit the spread of today's variants, but prevent new ones from emerging tomorrow. Let me finish by reminding you that PAHO is a strong believer in the life-saving power of vaccines. Based on the evidence that we have now on the variants of concern, we are confident that our growing portfolio of COVID-19 vaccines remains useful and will guide us through the end of this pandemic. Our trust remains unabated. We have at our hands a whole generation of effective vaccines to prevent infection and especially severe disease. Down the line, we may need to adapt our strategies, but we will continue to rely on these vaccines. The challenge now remains to ensure that these vaccines are distributed quickly and fairly across our region, starting with those who need them most. Over.
Muchas gracias, doctora
Thank you
Etienne.
very much, Dr. Etienne. Now we will be accepting questions, and let me remind you that you can send your question through the chat and Q&A buttons, and we also have simultaneous interpretation into Spanish, Portuguese, French, and English. We have received several questions in connection with the preparation of countries to start administering vaccines, and the questions are whether the question is whether the countries that have not started vaccination, what they can do, and what is the level of preparation for the arrival and deployment of the vaccines. Dr. Etienne.
So let me thank you for this question. PAHO has been supporting its member countries in their preparations to introduce the COVID-19 vaccines. And we have provided technical cooperation to help countries plan their vaccine deployment. We have distributed guidance documents, we have held training sessions, and we are giving the countries direct advice. We work with countries on their logistics to coordinate the delivery of doses and the monitoring of safety data, which is extremely important. We are also providing support with the recruiting and training of staff so that health personnel know how to deliver vaccines, and we advise them on public information campaigns to ensure that the people know where, when, and why to receive those vaccines. Let me inform you, thus far, some 31 countries of the Americas have provided information about their COVID-19 vaccine readiness through a tool that is called the Vaccine Introduction Readiness Tool, of VIRAT for short. And this is an online platform that is maintained by PAHO, WHO, UNICEF, and the World Bank. Of these countries, 21 have shared their national vaccination plan, and 20 have reviewed their cold chain equipment and procedures. The main challenges that were identified by countries relate to their information systems and not having sufficient trained staff. We have noted that 20 countries so far have evaluated their cold chain capacity to be able to handle these vaccines, as mainly those that require temperatures between 2 and 8 degrees centigrade. Now, this is really the same equipment that they regularly use in their immunization programs in maintaining the cold chain. I have made the statement, and I will say it again, our countries in the Americas have really very long, many years of experience in immunization, reaching coverages of over 90% of the target populations. And they have significant experience in doing immunization campaigns. So we are really helping them to boost that knowledge and that experience so they are ready to roll out vaccines immediately. Thank you.
Gracias, doctora Etienne. En seguimiento también
Thank
con
you,
este...
Dr. Etienne. And we also have a follow-up question by Cecibel Romero from Salud con Lupa. He would like to receive more information on the vaccination plans and the preparation of the cold chain in the region, but in particular in El Salvador, Guatemala, Honduras, and Nicaragua that have not started vaccination yet. He would like to have more detailed information regarding this. Dr. Barbosa? Thank you. Thank you very much for the question. As the director just mentioned, PAHO has been supporting the countries in the preparation of their plans for immunization, and we started this in March last year. That's when we sent the first guidelines as to how to start preparation of immunization plans. It is not sufficient to have a vaccine. We need to have all the countries need to have all the regulatory mechanisms as well as licenses for importation. So we are supporting those countries, and the countries are invited to share their data through this tool that was mentioned, the VRAT tool, which is a public tool, and this is a self-assessment of more than 100 aspects that are necessary for a country to be ready for vaccination. But we are also requesting countries to send their plans for PAHO's review so that we can improve, identify gaps. 31 countries have already shared their information through VRAT. More than 20 countries have already sent their plans for the review. For the 10 countries that are supported, that is to say, that are going to receive the vaccine through COVAX without the need to pay for the vaccine, and the 4 countries that, out of the 4 countries that the journalist mentioned, 3 are in this case, those countries had to provide the plan, and as part of the regional committee of COVAX, we are going to review all of the aspects and also present suggestions and comments to the countries. These are countries, these 4 countries in the region that you just mentioned are getting ready, because this is going to be key so that the delivery of the vaccine can be done within a system that is prepared with all of the aspects. Thank you very much. Thank you, doctor. Now I would like to give the floor to Rosana Tabacman. She is with Medscape. Roxana, you have the floor.
My question is, the ability to monitor viral evolution through sequences are not distributed evenly in Latin America, but the impact is a global one. So which is your recommendation as minimal monthly sequencing, for example, in the reality of Latin America today? Who should pay the bill, because it's for everyone, the interest? And in a landscape of financial constraint, at what level should be prioritized, because there is lack of money for all the necessities? And I have a second question, that is, which is your recommendation also for Latin America? When a new variant of concern is detected for the first time, if there is any evidence of closing frontiers, and when I talk about frontiers, can be country frontiers, but also state or city, because there are many examples that the people is not allowed to go out of the city because a variant of concern.
Gracias, Roxana. Doctora Aldiguieri, ¿podría contestar?
Thank you, Roxana. Dr. Aldiguieri, could you please answer?
Thank you. Thanks a lot for this set of questions. And there are many questions grouped in 2 groups, I would say. And as of first, Dr. Etienne provided all of us with a very comprehensive panorama and regarding how the genomic surveillance is important at this moment, at this time of the pandemic. I'd like to provide you with some more information, and also will try to address your concerns. As of 8 February, it means 2 days ago, 37 countries and territories in the Americas have published their genomes in a global platform which is called GS8. It's 113,000 genomes were published by these 37 countries, and it represents 20% of the global, the total of genomes published at global level. So this is important. The other aspect, repeating what Dr. Etienne said, the 3 variants of concern have been detected in 20 countries in the Americas. So the main goal of the regional network for genomic surveillance is to increase the geographic coverage of the surveillance, but also the number of samples that are sequenced among the many cases that are laboratory confirmed every week. This network, coordinated by PAHO, is accessible to all countries, but it's important to mention there are two groups. The first group is the countries that can do the sequencing themselves, and we have a set of recommendations for them. And the other group is the group of countries that can ship to one of the regional laboratories in Public Health Institute of Chile or Fiocruz Foundation in Brazil. It's important to mention that the US CDC is also assisting directly countries through its own country offices. So what PAHO is doing? PAHO is providing countries with, of course, technical guidance, but also with the reagents to do the sequencing and with the equipment for doing the sequencing. And it's also funding the shipment to regional reference laboratories. However, we are hopeful that the governments would assign more funding and fund both their own network when existing and their the shipment, international shipment. But we remain available to the countries for assisting in these two aspects. So trying to answer your question, we see two levels of priority. The first level of priority is really ensuring a coordination, integration of a national network within the countries. For example, including integrating academic institutions, work all of them, all the labs in the same line, I would say, for doing the sequencing. But also linking closely the epidemiological surveillance systems and the genomic surveillance system with clear triggers for increasing the rate of sequencing, for example, when the incidence in one specific territory of country changes by 50% in a short period. So regarding public health measures in a context of variant of concern, and we have 3 on the table at this moment, reported in 20 countries and territories of the Americas. PAHO is asking the national and the local authorities, as well as the public, to continue their efforts in curbing the transmission of COVID-19, in implementing strictly the public health measures. All countries, provinces, states have developed their own guidelines and battery of public health measures. It's now a matter of collective discipline in implementing strictly these public health measures. Regarding travel-related measures, international travel-related measures, we are recommending to countries to have a risk-based approach. However, we are aware that in some situations, as land borders, the implementation is very challenging. The example of the tri-border area between Brazil, Peru, and Colombia has been mentioned previously by our director. These are challenging environments, and specific measures in trans-border coordination should be implemented. I hope I have answered your concern. Over.
Muchas gracias, doctora.
Thank you very much, Dr. Aldigueri. The next questions are related to Venezuela. These are in English, and this is from Brian Edworth from Reuters, and this is a similar question from Nicole Charcour, Bloomberg, and Mariana de Barrios from TV Venezuela. The question in English is the following.
Payment deadline for Venezuela to receive vaccines through the COVAX program, as announced last week by PAHO's Chief of Missions in Venezuela. We'd like to know if the deadline goes through the end of today, yesterday, I think, and if there is a possibility that the deadline could be extended in order to give more time to reach an agreement. Doctor Barbosa, ¿podría comenzar?
Thank you for this question. The deadline of yesterday was the deadline for the countries that are AMC supported countries. These countries had until yesterday to upload their national deployment on vaccines plan to be reviewed by the regional committee, that is PAHO and other partners, and to prove that they are ready to receive and to deliver the vaccines. This is not the case of Venezuela. Venezuela is part of COVAX. We are in negotiation. with COVAX because Venezuela should have made the payment already. But due to the difficult situation in Venezuela, it is taking more time. And we are asking for COVAX to have a flexible schedule to receive the payment when it is available and to keep Venezuela as a self-financing country in the mechanism.
Gracias, doctor. Y una pregunta más relacionada con Venezuela.
Thank you very much, doctor. This is another question by Kevin Arteaga from Carabunero. This is also related to Venezuela, and he's asking whether the health authorities in Venezuela have been able to increase the diagnostic capabilities by applying the antigen tests. He is saying that only 1% of the total sent by the organization had been applied up to a month ago. Dr. Ugarte, thank you very much for that question. Indeed, there is an assessment going on the ground in all of the areas where the vectors and the tests were deployed, and the preliminary data shows that indeed the tests have been used up to 10,000. 10,000 of the tests have been used as of December 1st and February 5th. That is, we're talking about a significant increase compared to the previous figures. Several components of the process are being analyzed, and also the facilities, the labs, the personal training, logistical aspects for testing, the dissemination of information so that adjustments can be introduced to have more accurate information, and so that these tests are used based on the plans we had. Thank you.
Thank you very much. The next question is from IFP, Adina Dieste, and there are some questions related to the AstraZeneca vaccine. Adina Dieste says, Dr. Etienne has just affirmed the trust of PAHO in the portfolio of vaccines, and she wants to know what vaccines are we talking about. The AstraZeneca vaccine represents the most doses that will be distributed through COVAX. What is the assessment by PAHO of the AstraZeneca vaccine, especially to fight the new variants in the region? And another question is, what message can we give to the people who are doubting whether to take the AstraZeneca vaccine or not? Dr. Barbosa. Thank you very much for your question. Our director, Dr. Etienne, is referring to all manufacturers who have submitted proposals for through the COVAX facility. In addition to AstraZeneca, we have Pfizer, Johnson, and many other manufacturers. The AstraZeneca vaccine today was recommended to be used by the strategic group of experts of the World Health Organization. This group has experts from all over the world, and for many years, they have been the group making recommendations for immunization programs in all countries. And the recommendation says very clearly that the AstraZeneca vaccine has an effectiveness of 63% in general, and during South Africa, during the clinical trials that the vaccine was being carried out, there was a small number of patients where there was a reduction of efficaciousness for mild and moderate types of the disease, but there is no data whether this new variant identified in South Africa can change the effectiveness of the vaccine for serious cases, which is the main objective for using the vaccine. But let me underline, and our director has already called attention to this, this finding, if if it is so. At that point in time, the AstraZeneca vaccine was under a clinical trial in the field in South Africa. We don't know whether other vaccines may be affected by the new variants, and this is why it is necessary to maintain vigilance and surveillance and take all the necessary initiatives to protect people, to decrease transmission of the virus by using masks, keeping your physical distance, avoiding crowds, and have seek for more access to vaccines. This is the best way to protect. We are, of course, looking for more data. The global surveillance system on vaccines will be looking for more data on the new variants and their impact on the vaccines, because there is a possibility there that they may reduce effectiveness in any of the vaccines. So, in summary, with the data we have, yes, AstraZeneca is an effective and safe vaccine. It is a vaccine that, according to the information we have to this point, needs to be used, to continue to be used. And this is the recommendation by the strategic expert group in immunizations from the WHO. Thank you. Thank you, doctor. There are several questions from other journalist, Eliana Cornejo from Diario El Mundo from El Salvador, is asking whether the AstraZeneca vaccine has been approved by WHO, and if the recent findings could delay shipments. And also she has questions about the shipments of Pfizer vaccines to El Salvador. Thank you for the question. Regarding approval, approval may mean many things. I'm going to talk about two situations regarding a vaccine. First of all, in order for a vaccine to be used through the COVAX facility and be able to be purchased by the revolving fund of PAHO, and together with UNICEF, we are the mechanisms to purchase those vaccines. Any vaccine needs to be pre-qualified or have the authorization of emergency use by the World Health Organization. AstraZeneca vaccine is under evaluation, and we hope that the emergency use authorization will be issued soon, because the assessment is an assessment as if it were for three vaccines. We are evaluating the AstraZeneca original vaccine and the two sites of production of AstraZeneca, which are going to be providing vaccines for COVAX, the one in India and the institute in South Korea, South Korea, BioSafe. So the process is more complex because you are evaluating the original vaccine and then the other two sites in India and South Korea. And the whole process requires exactly the same standards, the same quality level. Everything is very similar, but this will be completed either Friday or Monday. The other issue is the recommendation for use. Yes, the vaccine has been recommended for use. As I said before, the strategic immunization group, which is called SAGE in English, Monday they reviewed all the data, and today their recommendation was published that yes, the vaccine should be used. And of course, this recommendation, as with for any other vaccine, will continue to be monitored, and all the data, the real life data, what's happening with the vaccines, what is their actual effectiveness when they are used. And this is true also for the AstraZeneca vaccine, and also for all the other vaccines that are being used, so that those recommendations are added to other data that are found. Remember that the data from clinical data, that reduction in South Africa was in a very small number of cases. So we need to have more data in order about any vaccine. so that we can gather all these data. But with the information we have to date, yes, the recommendation, yes, it should be used. Regarding dates, the expectation is to up to February 15th. So the first that will be receiving the information are the countries themselves. And when the countries receive that information, they will share it with journalists immediately as they receive the information. So when the countries receive the information, they will share it. The COVAX facility will report, it will inform each country the date, the amount of vaccines they're going to receive so that the countries can follow with their vaccination plans, given the amount of vaccine. Thank you. Thank you, doctor. There is a question now from Lucia Sor Miguel from El Diario La Nación from Argentina. And if you can hear us, please, Lucia Sol Miguel, I am giving you the floor. Yes, thank you very much. I would like to know what difficulties there are for migrants and refugees to get vaccination in the region. Thank you very much.
Lucia.
Thank you, Lucia. Dr. Ugarte. Thank you, Lucia. This is a very significant question. In our region, we have millions of migrants. And I would like to start by saying that migrants respond to the generosity of the countries with economic, social, and cultural benefits. And in this sense, one of the main problems that migrants have is their becoming regularized regarding their legal status in the countries. This would allow them to access health services and, of course, the COVID vaccine eventually, depending on the priority group they are in. Many of these migrants work in the health sector, so very likely they are going to be included in the first phase of vaccine distribution. However, there are many others who work in the informal sector, and they would not be able to receive the vaccine, and they have not been detected even, and they're not part of the plan of the planning. And many of them would rather not be identified for several reasons. And in this sense, this is one of the greatest difficulties. The other one has to do with the availability of vaccines for the countries themselves and for the priority populations in those countries. In that sense, then, the countries receiving larger amounts of vaccines will be more likely to include migrants, either because most of the countries in the regions of the Americas, I would have to say, have specific provisions and specific standards, including migrants in epidemic programs, and they include the migrants in this. And others that do not include them have made the decision to include them because it is the appropriate measure to control the pandemic in the countries. And hence, it is very important to underline the generosity of many countries of the region and the announcement made by by President Duque of Colombia to regularize the situation of the Venezuelan migrants. It is a significant step so that these migrants will have access to health services and also to jobs and to other elements of daily life, and so that they can contribute to the economy as well. So this is a constant and ongoing process. It's an advocacy work from many agencies from the United Nations and other countries that are giving vaccine access to the migrants, and they see this as a measure to control transmission of the virus and controlling the pandemic in their countries. Thank you, Doctor. Now in English.
CBC News, Alia Briggs, I'd like to give you the floor to ask your question if you are listening to us.
Thank you, Sebastian. So in light of recent data which indicates that the AstraZeneca vaccine provides minimal protection against new variants of COVID, a number of Caribbean countries, particularly here in Barbados, we've received 100,000 doses of this vaccine. In light of that, should our public health authorities reevaluate the vaccination rollout strategy, Or would you say that it is safe for the public to receive these vaccines, although there's a chance that you could still get the virus?
Thank you, Alia. Dr. Barbosa?
Thank you for this question, Lilian.
Thank you, Alia.
Let me correct the information that you provided. It's not true that the AstraZeneca vaccine showed the significant reduction for the variants. No, this is not correct. The correct is that during the phase 1, phase 2 clinical trials in South Africa, in a small number of participants of this trial was detected a reduction in the efficacy for mild and for mild cases, mild and moderate cases only. We don't have enough data about the efficacy implications for severe cases, for instance. And this was only for the variant that is circulating in South Africa. We cannot expand this to all the other variants. It's not the correct way to approach this problem. So as I mentioned before, today, the strategic advisory group of experts on immunization of WHO released their recommendation. You can go online and see it's very detailed information about this in a very transparent way. But with the data that you have so far, the SAGE group is recommending the use of the AstraZeneca vaccine because we need more data to confirm if there is really a decrease in the efficacy in real life, not only in a small number of patients. And second, this decrease was experienced in mild and moderate cases. We don't have evidence showing that the efficacy was reduced for severe cases, hospitalized cases, and deaths. So the recommendation is to use the vaccine to get more data, not only for these vaccines, but for all other vaccines that can be affected by the new variants. So we need to keep vaccinating and at the same time collecting more data and to see what is the real effect of these new variants on the vaccine efficacy. Thank you.
Gracias, doctor. La siguiente.
Thank you, doctor. The next questions are from Bruce Kaya Alice, correspondent in Mexico, CNN in Spanish, and Nuritma Martinez from El Sol of Mexico. They say that the Johns Hopkins University published a study locating Mexico with the highest level of mortality due to COVID-19 in the world. And so they want to ask about the policies and what does PAHO suggest to reduce mortality. Dr. Aldigueri, please. Thank you very much for your question from CNN Mexico and the other colleague, journalist colleague in Mexico as well. First of all, I would like to emphasize that Mexico reports all their cases and deaths every single day as required. And in our database, Mexico, in fact, is in third place of the accumulated number of deaths in the region of the Americas after the United States. They have more than 461,000 deaths. Brazil with over 232,000 deaths, and Mexico with an accumulated value of more than 166,000 deaths. In Mexico, there has been an increase in cases detected with a spike in prior weeks during the third week in January of 2021. And what we are seeing at this point in time is that the number of new cases this epidemiological week has a trend downward. The mortality numbers are stable, but we need to take into account that, as we've known from the beginning of the pandemic, and the more we have learned about the virus, there is a difference of 3 weeks or more between the curve of new cases and the curve of deaths. So it is important to also mention that that increase or that spike noticed in January of this year has affected mostly the central region of the country, which is the most populous one, where we have the state of Mexico and the Mexico City and other surrounded states. And it has increased the number of people attending hospital and with a larger number of complicated cases going to the ICU. Our team in Mexico works directly with the Secretariat of Health to improve uh, early detection of patients who are still in their homes or patients who go to primary health care units. Also regarding uh, this and how they can be referred to hospitals and other levels. And we are also working on the chain of medical oxygen provision, which has been challenging in some regions in Mexico. I hope I answered your questions. Thank you. Thank you very much, Doctor. Now we have several questions from Chris Vilches, who is from Zona Lima, from the group of El Comercio in Peru. He asks, what advances are in uh, uh, obtaining vaccines through COVAX, and when will we'll be signing the agreements with Pfizer and AstraZeneca, and also the doses with Sinopharm, Dr. Barbosa. Thank you for your questions, Chris. First of all, as we said at the beginning, and this is just to remind you, the COVAX facility sent a letter to all countries in the world, so more than 190 countries participating in the facility, with the first estimate regarding the number of doses that will be shipped in the first half of the year. The exact date of when the doses will be arriving will be sent out on February 15th directly to the countries. Peru is a participant in the COVAX facility, and Peru is one of the 4 countries in the region selected by the COVAX facility for an initiative called First Wave. This first wave is a small number of Pfizer doses that need to be used for healthcare professionals. So, following certain criteria, 4 countries in the region were chosen. 2 countries that are MC support countries that will be receiving support from COVAX. In other words, they will be receiving the vaccines free of charge, and the high financing countries, Colombia and Peru. And the criteria used was using the mortality rate in the last 28 days as the proxy for the risk of the health professionals in these countries. So in Peru, and Peru has confirmed that they have the capacity. It will be a small amount of Pfizer vaccines, but they have the ability, the capacity to store these doses of Pfizer vaccine, and by February 15th, they will be receiving information regarding the first wave. It seems that at the end of February, beginning of March, Peru will also know about the doses in the regular shipments from the COVAX facility. The countries will be receiving this information. It is a complex logistics because we have over 190 countries. Unfortunately, we have flights that were canceled, but we are all working very much through UNICEF and the revolving fund of PAHO to have the vaccines for the countries, and the decision of Peru to use the Sinopharm vaccine is each country is sovereign to decide what vaccines they will use. And what is important here is that the country can share with the population all information regarding all the regulatory procedures they have adopted and the basis for their decision making. But we do not evaluate those individual decisions by the countries. The Sinopharma was also offered for the COVAX facility. It is being evaluated at present. Sinopharm and Sinovac, the two Chinese manufacturers, requested access to the COVAX facility. WHO sent a team of inspectors to China, and they have spent over a week there assessing the two manufacturing plants, and we are expecting any decision of pre-qualification or emergency use authorization for Sinovac and the other Chinese produced vaccine will be ready by March. At this point in time, we cannot emit an opinion, but each country, I'm sure, have made their decisions based on information that they exchange privately with the manufacturers. Thank you. Thank you very much, Doctor. Now in English.
The PGD2 radio pregunta en San Martin. Pregunta, many
Asks,
persons in the region are skeptical about taking the COVID-19 vaccine. How do you convince people that taking the vaccine is the right thing to do? Dr. Barbosa?
Thank you for the question. I think that this is, sometimes we are surprised to see that in 2021, after so many decades that the vaccines have saved millions of lives, we still have to answer this question, but it's very important that you raise this up, because many people now in the, not only in the Americas, but in the world, are making the same question. First, it's important to say that the vaccines that we have now for COVID-19, they are the outcome of an unprecedented movement of producers, biotech companies that develop vaccines using many different technological platforms. These vaccines, they benefited from other researchers for other coronavirus and other viruses that have been researched in recent decades. Second, the vaccines, to be approved, they needed to show the evidence to the regulators in each country and to WHO to receive the pre-qualification or the emergency use list authorization. They need to show the evidence that the producer has good manufacturing standards. They need to show that they have performed the clinical, preclinical, and clinical trials, phase 1, 2, and 3, that their vaccine is safety and efficacious. So there is no different approach to these vaccines. All the regulators and WHO, they are trying to have more expedited processes, but all the dossiers of the producers are being reviewed carefully, thoroughly, to release the authorization only after we have the confirmation that these data are sound, that these data are showing that the vaccine is safe and efficacious. So I think that it's very important to also to respond to some myths. Some people are saying that the vaccine has a microchip. This is kind of a conspiracy theory, but unfortunately, some people that don't have access to media vehicles, that are only receiving information from their friends on social media, they need to be aware of the danger that this kind of misinformation, or that vaccines can change your DNA. This is not true. Absolutely, it's not true. So I think that it's very important, and we are highlighting the crucial role that the national authorities, the Ministry of Health, need to have this permanent dialogue using the social media, the media vehicles, the newspapers, TV, radio, all the instruments that we have to tell the population how the vaccines are developed, produced, how we can access their safety and efficacy. And I think that responded to all the questions that some people have. We have a small group of people that are against vaccine, but this is a small group. But we have, I think, that an important group that has doubts about the vaccine, that wants to receive more answers. So it's very important. We, here at PAHO, we had 2 workshops for journalists, specifically to tell them the whole process to produce and to approve a vaccine. And we encourage you to ask the Ministry of Health, also specialists, the scientific community. So I think that is very important to bring all the information we have, because vaccines have saved millions of lives since in last century, in the first decades of this century, and the vaccine is the best way that we will get the full control of the pandemic. So it's very important to show the data, the evidence, to have in a very transparent way to convince the communities, families, and people about the benefits that the vaccines will provide to them. Thank you for this question.
Muchas gracias, doctor.
Thank you very much, doctor. One more question. One last question from Karim Joseph from Observer Media from Antigua.
For countries like Antigua and Barbuda with limited resources who are in the middle of a major spike in cases? Doctor Barbosa, si usted podría contestar quizás.
Yes, no,
Dr.
thank you.
Barbosa, could you answer, please?
Because even countries that have started the vaccination, the vaccine is not a silver bullet. The vaccine will not stop the transmission next week. So probably we will face months ahead of us that while we are getting more vaccines and to have more people vaccinated, we need to keep the measures that we know. We have now tons of evidence showing that wearing masks, keeping physical distance, avoiding closed and crowded spaces are a very efficient way to prevent the transmission. So this is I think that the general recommendation, of course, that every country needs to monitor the situation, because sometimes you have in a country, one city is the situation is relatively controlled, but in other city, the cases are increasing. So this is important also that the health authorities in each country need to monitor. But again, we expect that we will have to vaccinate at least 70% of the population to achieve collective community or herd immunity to control the transmission. So we are not talking about days or weeks. We are talking about months. So let's keep all the measures that we know that can prevent in order to these measures working together with the vaccines achieve the reduction of the transmission and in the near future, the control of the transmission of COVID-19 pandemic. Thank you.
Gracias, doctor. Ahora sí, estamos llegando al final de nuestro media
This is now the end of our media briefing, and we have received a few questions about vaccines and what PAHO is doing. So what is PAHO doing to accelerate the shipments of vaccines to the area? Dr. Etienne, please.
Thank you for this question. So let me begin by explaining that in Latin America and the Caribbean, we will need to immunize approximately 500 million people to be able to control the pandemic. Some countries have already begun purchasing vaccines directly from manufacturers, and they have begun their vaccination programs. Because we foresaw the possible lack of equity in accessing vaccines, because we knew that there would be some production issues everywhere, COVAX was formed. And COVAX is a coalition that is led by WHO and Gavi, and has set the initial goal of providing vaccines for at least 20% of the population in each of its participating countries. Now, there are 37 countries in our region that are participating in COVAX. And COVAX, as you would have listened from Dr. Barbosa, COVAX has signed purchase agreements with AstraZeneca. There are a basket of vaccines that they are negotiating with and looking to have agreements. Countries in our region will start to receive deliveries of vaccines by the end of this month to protect the populations who are most at risk from severe forms of COVID-19. Of course, this includes healthcare workers, older populations, and persons on the front line. So in Latin America and the Caribbean, 37 countries will receive vaccines through COVAX. And of that 37, 27 are purchasing with their own financing, and 10 of them will do so at no cost to the economic condition, due to the economic condition or their population size. Now, these doses and the availability of vaccine under COVAX are still subject to the emergency use listing by WHO. Of course, the manufacturing production capacity, as well as establishing the supply agreements between the producers, PAHO, and UNICEF. Our PAHO revolving fund with UNICEF are the purchasing mechanisms for COVAX. But PAHO is also beginning to explore how could we assist countries in terms of the other percentage, was it 50%, is it 60%, to achieve herd immunity, and through the revolving fund to make those accessible to countries. Of course, PAHO and WHO and our Director General is really very concerned about the lack of equity in terms of access to vaccines. And we are approaching this on many fronts. Our Director General is having discussions with many of the very high income countries and to see how they can contribute to COVAX and to ensure that all countries have some reasonable access to vaccines. But I want to re-emphasize the last point that Dr. Barbosa made. Vaccines are not going to solve our problems immediately. And so we have to do everything that we can to reduce the circulation of the virus. And to do that, we have to use the proven public health measures, and which includes staying at home when possible, wearing masks, social distancing, and washing your hands frequently. And governments will also have to ensure that their public health measures are also beefed up in terms of identification of cases and quarantine, etc. That they take the measures that are necessary to help to protect the population. So this is our call out to you. Please do not let down your guard. continue the public health measures as we await vaccines. But even when we get vaccines, we will simultaneously have to reinforce our public health measures. Thank you for being with us today, and we'll see you next week.
Muchas gracias, doctora Etienne. Ahora sí, hemos llegado
Thank you very much, Dr. Etienne. This is the end of our press briefing today, and we're going to share with you the webpage we mentioned about VIRAT, which is the Vaccine Introduction Readiness Tool. And this is the information being provided by the countries voluntarily. And you will be able to find more information there. We will be sending you the speech by Dr. Etienne, and you will find information on our website, paho.org/coronavirus. Again, thank you very much, and we'll see you next Wednesday. Greetings to all.